Hello, everyone, and welcome back. Dr. Samina Mitha here, naturopathic doctor. And today, what we're going to be talking about is the top 5 supplements for PCOS and infertility that I've personally seen clinically work well, and also that I've seen in the research to have enough information for us to really use for those women who are trying to conceive and who have PCOS. So, surprisingly, or not surprisingly, I should say, the first supplement is myo-inositol. So this is by far, one of the go-to supplements for PCOS in general, but also for fertility outcomes. It's probably one of the most talked about therapeutic agents with women who have PCOS who are trying to conceive. The reason being is that myo-inositol can have a big impact on ovarian health, and it has so many benefits that I'm going to highlight in just a second. So, the first thing is that it actually really improves insulin sensitivity, which can ultimately help to restore ovulation, which is so important when it comes to PCOS because we often find that PCOS or in PCOS, ovulation is delayed. And in fact, some studies have actually said that myo-inositol can be just as good as metformin. There was a study that was completed in 2010, and it showed that myo-inositol was superior to metformin. Several studies have also reported that myo-inositol can actually help the fluid that's inside the follicle that houses the egg. So therefore, it can actually help with improving egg quality and maturation. It's so important, especially in PCOS, as sometimes egg quality can be compromised, but also just in general, with women who are going through IVF, myo-inositol can be a really great option. It also helps to improve the response to LH, this is luteinizing hormone, and FSH, follicle stimulating hormone, from the brain to the ovary, therefore ultimately helping with ovulation. It can also improve follicular health, like we spoke about, but also implantation rates in women who are going through IVF. So many benefits to myo-inositol, especially in PCOS, and its ability to work around sensitizing the cell to insulin, so helping to reduce insulin resistance and also help ovarian and egg quality. Okay, so let's talk about N-acetylcysteine. So N-acetylcysteine is a very important supplement that's been specifically researched for PCOS and infertility. N-acetylcysteine is actually derived from an amino acid called L-cysteine, and it's historically been used to help thin the mucus during bronchitis and different chest-related concerns. But in terms of PCOS and infertility, there's a few benefits that we should really talk about. So the first one is its antioxidant properties. It's actually a precursor to the most important antioxidant, I would say, in our body called glutathione. Therefore, N-acetylcysteine has very great anti-inflammatory benefits. So if there's any inflammation present, it can be really helpful in those cases. It's actually been shown to improve insulin sensitivity, so it can actually help with insulin resistance as well. And it's actually been shown when it's used in conjunction, or in a study, they actually used it in conjunction with letrozole, and it actually improved rates of ovulation and pregnancy rates. So it could even help with ovulation in PCOS. Additionally, N-acetylcysteine actually can help to reduce serum testosterone levels, which is so important when it comes to PCOS, since we know testosterone can be high in many, many cases. So N-acetylcysteine, really great antioxidant and lots of good benefits to PCOS, such as insulin resistance, reducing insulin resistance, helping with egg quality, and also ovulation and reducing testosterone. Okay, so let's talk about coenzyme Q10, really popular antioxidant for fertility in general, but just to give you a background, the mitochondria is a cell in the body that produces energy. And in order to produce this energy, we need coenzyme Q10. So in our bodies, we have the most amount of coenzyme Q10, or a really large concentration of mitochondria in our ovaries, meaning we have the most amount of coenzyme Q10 in our ovaries in general. So additionally, only the mitochondria from the mother is passed down to the embryo. So it's really important to help the mitochondria and support its functions. And the way we do that is giving a little bit of coenzyme Q10. Oftentimes, the doses for coenzyme Q10 can range from 200 to 600 milligrams. So, talk to your doctor, naturopathic doctor, about what dose is appropriate in your case. So, coenzyme Q10, it's an antioxidant like we said. It can actually improve the number of mature follicles, endometrial lining, and improve ovulation rates in women with PCOS. And also has been shown to help in those women who are resistant to the drug, the fertility drug called Clomid. It also can improve glucose control, blood pressure, and elevated cholesterol, and actually can preserve ovarian reserve. So really, really great supplement for PCOS and infertility. So number 4 is probably one of the most important vitamins we have, called vitamin D, known to be our sunshine vitamin. And additionally, it's actually extremely important for women who have PCOS and have hormonal imbalances. In fact, vitamin D is actually more similar to a hormone, and it influences so many of the biochemical processes in the reproductive system. We actually have found that vitamin D has receptor sites in all areas of the reproductive system: the ovary, the endometrium, and the placenta. So it affects our correcting the deficiency, and when we correct the deficiency, it actually boosts ovulation, improves hormone levels such as LH, insulin, testosterone, and sex hormone binding globulin. It improves insulin resistance in women with PCOS, which ultimately even helps to raise pregnancy rates in women undergoing IVF. So super important to make sure you've checked your vitamin D in the blood, making sure you aren't deficient, and if you are, you're regularly taking it. Even if you do get sun exposure, really for sun exposure, you need to be out there for at least 30 minutes, seeing your skin getting, red, to know that you have had enough vitamin D absorbed into your skin. If you aren't getting that, which is very common in Canada where we live, it's really important to be taking vitamin D consistently throughout the year. Last but not least are botanicals. These are herbal plant extracts that can be really helpful for women with PCOS. There's a few that I'm going to mention here called black cohosh, which is Simicifuga racemosa, which can actually help with ovulation and supporting healthy estrogen levels to help women with PCOS to ovulate. And then also licorice and white peony together in a 50-50 ratio can actually help promote ovulation and also reduce testosterone levels. So hope that was helpful. These are the top 5 supplements for PCOS and infertility to consider. If you have any questions, please drop them in the comments below, and I'll see you in the next video.